On-the-scene coverage of ACC.13 is supported by Janssen Pharmaceuticals, Incorporated.
Hello, I'm Tony DeMaria, and I'm here talking to Dr. Paul Douglas at the ACC.13 meeting in San Francisco. A very exciting meeting, lots of new data. And Paul, the problem of diastolic dysfunction, or as we all refer to it now, heart failure with preserved ejection fraction, that's been a bugaboo. There just hasn't been any good treatment. There was a trial presented today, the RELAX trial, that aimed to evaluate a potential therapy. What do you think?
Well, this has been a real challenge for most clinicians, that, almost 50% of people with heart failure will have preserved ejection fractions, and we really just don't have good therapies for them, unfortunately. So the RELAX trial offered a lot of promise. Phosphodiesterase 5 inhibitors, it made sense. There had been some clinical trials that had small clinical trials that had suggested that maybe this as a target would enhance the production of cyclic GMP, maybe would turn off the remodeling process, improve vascular function, renal function. So it made sense that maybe this was something that we could do that would help us in terms of managing these patients.
Sure, and we all knew that there was a PDE5 inhibitor, Viagra sildenafil, that had been used clinically not only for erectile dysfunction but also for pulmonary hypertension. So there was a PDE inhibitor available that might be a benefit.
Exactly, and it made sense. I think it made good clinical sense. We certainly have very little to offer these patients, and so the trial had a lot of potential. But unfortunately, it appears that if you look at measuring ability, the 6-minute walk test, and looking at VO2, that there was really no significant improvement. And so it's disappointing, but I think it helps us in terms of building a knowledge base for trying to identify targets that we can, and maybe we should be thinking about other things now.
Yeah, well, what I liked about the RELAX trial was that they used a meaningful endpoint at the end of 24 weeks, and that was VO2 consumption.
Right.
It's a hard endpoint, and if you could increase your VO2, you'd probably have better functionality. Unfortunately, it didn't work out. They also looked at a whole variety of echocardiographic measurements of diastolic performance, and there really wasn't much change there either.
Yeah, again, very, very disappointing. Very, very disappointing. This should have been an easy trial to recruit, especially men for, but it was a difficult trial to get into because you had to be able to walk those 6 minutes and to qualify for the trial, and the inclusion criteria was relatively strict. So it was a relatively small trial, only a little over 100 patients in each group, and so you would hope that you may have seen something, some signal that there might be some benefit, but it doesn't appear that there was any.
Yeah, I know. I take your point on that, and I think that was another strength, that oftentimes it's difficult to determine whether a patient really does have heart failure with preserved ejection fraction. They're a little bit short of breath, or maybe only with exercise, and they may have a little bit of an elevation of BNP or a biomarker. Right. And so in this study, they had rigid criteria, not only for ejection fraction, for some biomarkers, and in fact, in the absence of definitive information, they even required invasively measured pulmonary wedge pressure. So a very well characterized group of patients who really had this syndrome of HFpEF.
Exactly, and so it was well designed, and I think that the recruitment was a little difficult because it was so well designed, and so it was hard to get patients enrolled. But again, no real benefit. So that is indeed very, very disappointing, but I think that it helps us in terms of advancing our knowledge base.
Well, the search will go on. We'll continue to treat what we can treat, that is blood pressure and heart rate and ischemia, etc., and continue to look for a better treatment for heart failure with preserved ejection fraction. Thanks very much for watching.